talk to Doc, and before we ask questions, I want to talk to the audience first. Diba we're talking about obesity and weight management, right? Can you raise your right hand? Raise your right hand, tap the person to your right, and say, mag-exercise ka na. Okay, raise your left hand, tap the person to your left, and say, mag-diet ka na. Oh, Doc!
Okay, welcome back to Talk to Doc. Okay, surprises.
Time to ask questions now from our audience.
Yes.
Are you ready, Doc?
Yes.
Okay.
Hi, Doc. Kasi di ba before, obesity cases seem to be a problem only for Caucasians. Why do you think is there an increasing number of obesity cases in the Philippines?
Asians are starting to adapt a more Western lifestyle that way. So again, we mentioned we like to have fast food now. We have a lot of them going around. These are your convenience foods. We starting to get that upsize culture. And we want everything in excess, eat all you can. Then technology-wise, everything is convenient. So you hardly get out of the house anymore. So most of our activities are really indoors.
Lifestyle related.
Yes.
Okay, next question.
Next question.
Hi, Doc. Isn't it normal for growing kids to overeat or to have a good appetite?
It would be nice to have a good appetite. And kids, because they're growing up, everything's so new to them. If they like the taste, they really go for it. But for parents, it's your job or your responsibility to be able to control it when you notice that it's becoming excessive.
Yeah.
It's just a matter of moderation. You can really let them try anything. It's actually very nice that they have varied tastes.
Yeah.
So,
Well, also, I think it will help for parents to control the children's intake by telling them to just get enough food that they can finish.
yes.
Kasi ang problema dyan, yung parents yung mag-uubos yung tira eh. Tayo yung magiging obese. Di ba? Oh, next question.
We'd like to know then, as parents, when we can start controlling the weight of our kids.
Oh, you can start really, really early. Every opportunity that you are with your visiting your pediatrician is an opportunity to ask if your child is within the normal range for weight and height. So if you go above it in terms of, since we're talking about weight problems, if you are starting to be above the range, that's already an alarm that you should start thinking about what is it that I'm doing or not doing for my child that's becoming a problem now.
Well, the goal is actually to keep in mind the child's growth and development.
Yes.
Not only your own issues na, okay, I want my child chubby and cute.
Yes.
Because some parents even pay their yayas extra if their children are chubby and cute, di ba?
Yes. So, totoo yan. And chubbiness or cuteness is also a sign of prosperity for some culture. Diba? So somehow it means that you have a lot in the house. So it's a cultural thing.
Pero it's not right naman, Doc, kung mga 2 years old pa lang tapos weight management mo.
Hindi naman.
Hindi naman.
So emphasizing that
Hindi naman.
we need to emphasize that weight gain or excess weight is really just a balance of input and
Yes.
output.
Yes.
So, something like that lang.
Yeah,
So,
we don't really put them on a diet. We don't even want to think that we are putting these kids in our program into a diet. So that's not a thing we encourage. We want them to be able to make choices. Then you balance your food choices with activity. So do not expect to lose weight by just changing your dietary habits. You have to get out and be active.
Okay. So the parents have to be involved.
Yes.
Yes. Any more questions from our audience? Mukhang nahihiya na magtanong. Doc, any last words?
I think we just want you to be very conscious right now and live healthy lives. So make your good choices in terms of food and start picking an activity to get out of there, outdoors.
So don't buy your kids too much video games and don't allow them to stay indoors to watch TV.
And junk food.
Junk
Junk
Good choices.
food.
Yes.
Yan. Prepare your children's meals para mas healthy. di ba?
Yes.
Allow them to cook their meals
Yes,
para
we
mas
do.
economical.
Some of our patients do actually cook, and they learn from our dietitian or nutritionist. They prepare their own food for their family.
Oh, that's good. So this is also part of the program.
Yes, it's part of the
So
program.
you teach them how to cook and prepare their meals.
Not necessarily. Some of them have passion for food. That's why they
naman. Yeah.
So, but we turn that passion around
To something.
to something more positive.
Wow, that's really
Because
incredible.
developing the habit, that's the secret there.
Yeah.
We try to develop the habit, or else the program will fail if you don't address it that way.
Yeah, when it's all actually in your genes already and you can't do anything
Yes.
about it, what you can do about your life is to change your habits.
Yes.
Okay, wow. Thank you very much, Doc, for sharing your expertise with us.
You're welcome.
Thank you also to all those who emailed us, and thank you for sending in your questions. And of course, to our studio audience, thank you.
Join us again next week as we discuss diseases of the retina, which is very important for our eyes. So I'm Dr. Oyi Balburias.
I'm Maricel Laksa Pangilinan. Remember, don't be afraid to ask because we can
Talk to Doc.
Your doctor has seen many different patients, but none exactly like you. You are unique. The more your doctor knows you, the better he can help. And the more you know about your condition, the better decisions you can make. So tell your story, ask questions, talk to doc.
Your health depends on you and me.
A message of concern from the Medical City.